and welcome everyone to my final heart-to-heart program. I believe this is the seventh one of the year, so hopefully you've been able to catch several of those in the past. If not, they're on ACC Anywhere. And we'll also finish out with the final live one at ACC 24 in Atlanta in a couple of weeks. So hopefully we'll see you there as well. But I think this is a really good program that we have for you this evening. Very pleased that we have some of our leaders in the ACC International Acceleration Program. So several of the leaders here with us are on the virtual stage. They've all played and are continuing to play an integral role in helping us understand the biggest challenges to improve global heart health and how best to solve these challenges in the years ahead. And in fact, over the past year, they've been working very dutifully on a ACC International Acceleration Task Force to bring us to the next level. So I'm going to let the panelists introduce themselves. I'm going to go a little bit out of order because we may have some joining us a little bit later. So I'm going to start with Dr. Pamela Morris. Pam, if you'll introduce yourself briefly, and then we'll probably move on to Hani thereafter. Go ahead, Pam.
Well, hi, everyone. I'm Pam Morris. I'm a preventive cardiologist at the Medical University of South Carolina in Charleston, and a member, one of the trustees of the college, and a member of the Global Acceleration Task Force. I'm thrilled to be here tonight, so thank you, Hadley.
Thank you, Pam. And Hani, if you could go ahead with your introduction, please, sir.
Absolutely. My name is Hani Najm. I'm the chair of pediatric and adult congenital heart surgery at the Cleveland Clinic. And I'm also a board member, a trustee at the American College of Cardiology. And I have been the AIG chair also and previous international governor. So there's a lot of excitement about this, and delighted to be with you today.
Thanks, Hani. I'll start off with the first question to Dr. Morris. Pam, you're someone who's been long involved in ACC's global efforts. You've really walked the talk and really traveled quite extensively, doing a lot of teaching and interaction and collaboration globally. What would you say are some of the biggest global challenges or barriers to transforming cardiovascular care?
You know, I think this evening is one of the greatest examples of some of the challenges as we try to reach out and engage our international colleagues in dialogue. Certainly, the virtual environment can be a challenge, and technical difficulties are certainly ongoing. But I think one of the most important things that I've experienced is, particularly when it comes to engagement, advocacy, and education, it's really critically important to customize our efforts to the needs of the region. As everyone on this call well knows, there are marked differences in healthcare systems, in healthcare payment models, in terms of different varying guidelines and access to medications. Also variations in the socioeconomic profile of the patients who are trying to be reached in each of these countries. And as we reach out to engage our international leaders and our international colleagues, making sure that our approaches are relevant to those regions, relevant to those countries, I think is the thing that is most critical.
Thanks, Pam. And so now I'm going to turn it to another international leader for ACC. Hani, you've been past AIG chair and a longtime supporter of building global leaders through programs like the Hani Najm Global Scholar Award. Tell us a little bit about the importance of fostering the next generation of global cardiovascular clinicians, researchers, and leaders?
Absolutely, Hadley. So there's nothing better than exchange of information and exchange of education. And I find that there are a lot of international young cardiologists and surgeons around the world who look up for the ACC. And I think it's really important upon us to connect with the younger generation, trying to learn from the ACC as much as they can. Connecting them to the ACC annual meeting is a privilege to them and to us. It's not only one way education. I look at this as it's both ways. We learn also about their place. We learn about how they practice. As Pam was saying, we live in a very heterogeneous world in a way of how we practice, but at the same time, we're all striving for patient care. And patient care is where we have to learn how we can care for them in the best way. And that's why I look at connecting with the younger cardiologists and surgeons from around the world will bring in this mix of different backgrounds to the annual meeting, and at the same time showcase some of the great scientific data that are produced from all over the world and brought to the annual meeting. So I think this is a delightful initiative, and I think this connection really spreads the wings of the ACC all around the world with this global initiative.
You know, Hani, I love what you just said about this being a two-way street. I really love that because I'm always struck when I travel internationally. I think I'm going to provide education or engagement. There is absolutely no question that when I turn around and come home, I'm absolutely flabbergasted by it. Nothing could be farther from the truth. In fact, my international colleagues have taught me so much in terms of patient care. So I couldn't agree with you more.
Absolutely, Pam.
So those are very great points. And I just want to also point out to our audience that in your chat, there are some really strong resources that Autumn and Allie and Emma are providing to us this evening. And you can, learn more about our global hub and also about the Hani Najm Scholar Program and others, and as well as insert your own questions or suggestions into the chat. So we'll be monitoring that as well through the evening. I want to turn it back to Pam and maybe even also let Hani add on. But what are some of the opportunities that are being explored by the ACC's Trustees Global Acceleration Task Force to further accelerate the college's work on the ground in countries around the world? Where do we hope to be 5 years from now?
Well, so, I think...
What do you think about that?
Well, so one of the things, obviously for every chapter in ACC chapter that we have in international programs, we have a governor. And the international program would really like to collaborate and work. One of the things we work with them very closely. One of the things we hear from the governors time and time again is the desire of their members to be more engaged and involved in ACC committees, ACC sections, ACC education, the annual meeting, the international meetings. And so the governors, we've been working closely with the governors, and they're doing a great job of really helping international members to understand the application process or the nomination process to be a member of our committees, a member of our sections, a member of work groups, et cetera. And, each year when we have the nominating process for these positions, they're doing a great job of strengthening the quality of those nominations, strengthening the quality of the letters. We're very attentive in the nominations process to the importance of not only diversity in all other aspects, but also international diversity for representation on our committees. So I think that's one of the important aspects. You know, obviously another one, and then Hani, I'll let you make some comments too. I don't want to hog the stage here, but our international meetings, the ACC Latin America, ACC Asia Pacific, the ACC Middle East, is also a really important strategic priority for the college. Again, taking education to the region where that education is most needed and most relevant, and also providing the opportunity for our international colleagues to be on an ACC global stage. So I think those are only two. Hani, there are so many more things that we're trying to do. I'll turn it back to you.
Yeah, both of you have been on the nominating committee and actually currently serve on the nominating committee. And I know, Hani, you have really been keeping tabs on the committee applications from our international members and those that were successful. And also, I've heard you more than once say we need to try, as Pam was saying, to encourage and actually even mentor our international members on how to be successful with their committee applications. And they do add really some richness to these committees, like the membership committee, even the LLOC, the Lifelong Learning Committee as well. So why don't you tell me about your impression and experiences regarding international members and trying to grow their member engagement?
Absolutely, Hadley. So this task force really is meant to really tell the international community that we hear you, and we would like to make you part of the family of ACC. We hear what you want. So through our bilateral meetings, we hear from the international governors, we hear from different leaders of societies around the world, what are their aspirations to see or to have from the ACC. And the task force is really created to hear these requests, and partly is exactly as you said, Hadley and Pam. This is one way of getting them closer, is to have them be part of this different committees in the college. In addition, also provide to them ways of making benefit of all the products that the ACC is offering to the domestic chapters, as well as to the domestic cardiologists. The NCDR is a big thing that is now a part of the global quality solutions that international people can tap on. The NCDR Academy is something big that has been also very well tapped on. The International Centers of Excellence, we believe that also something that centers can apply to, and they can actually get and elevate their quality metrics. And more importantly, in the last year, we've initiated the Certified Cardiovascular Knowledge Exam for international cardiologists. I think this is an incredible exam that could be obtained by international cardiologists who may not have within their country a certifying exam for cardiologists. So there are so many initiatives that has been offered to international people, to international cardiologists from the college, and we would like to make sure that this is available, and we would like to hear from the international governors and our international community, what do they need more, and how can we fix it and make sure that it is available to them in a way that is fruitful to them, and they can deliver the best care for their patients.
Thanks.
You know, I wanted to come back to the education and the meetings. You know, I had the wonderful opportunity when Andy Cates and I co-chaired beginning in 2019. That was the very first time that we worked with the Assembly of International Governors to be absolutely certain that every international chapter had representation of international faculty as speakers and moderators at the annual meeting. And so we had nominations for expert faculty from every country it represented in the meeting, and that has continued through this time. You know, it's one step. It was a baby step toward making the meeting truly representative of our not only domestic but international membership. It's a baby step, but we had to start somewhere, and I think it was really it has been so meaningful. Hani talked about that that bilateral learning, and it definitely created that opportunity at the annual meeting for global perspectives.
Thanks, Pam. So before I go to some of the folks in the audience, and again, we are continuing to monitor the chat, and there are great resources there regarding our regional conferences like ACC Asia and Latin America and so forth, as well as the annual scientific sessions. Let me just ask both of you to say, with this task force, which you've been working on now, I would say more than 6 months, more like 8 months, what do you hope to gain, or what do you hope to see come from this over the next 3 to 5 years? What would be your goal? We're sitting at about 16,000 international members or members who live and work outside the U.S., out of a total of about 56,000 members, with 140 countries represented and 42 chapters. Where do you see this all going with the second part, or International Acceleration 2.0? Hani, why don't I ask you first?
Absolutely, Hadley. So yeah, sorry, I was muted. So yeah, the way I would phrase this is that how can we make the ACC is the home of international cardiologists? And that obviously is the bigger mission of this task force. And by doing so, we will accrue more members, we'll accrue more products, we will reach out to different regions of the world. We will be able to create more research projects like the GADI project, which has been a great success. We will be able to create exams or more availability of these exams to different cardiologists around the world. So how can we, the bigger mission is in this task force, the way I look at it, is how can we attract the international cardiologists so we can have this exchange of information, exchange of education, as well make the ACC as their home or their heart house. Now, with that, obviously, goes certain metrics. And that's why we are determined in this next 3 to 5 years that we acquire and achieve these metrics so we can get to this bigger vision. And obviously, as any project, an initiative that goes in, if it's not measured, you're not able to move with it. So this is how we're going to look at the bigger picture and how can we acquire the international cardiologist community and have ACC as their home for cardiac knowledge as well as for cardiac patient care.
Thanks. And Pam?
And Hani, I'll build on what you said also. I think that we want the membership in all of our efforts and all of our educational efforts to be representative of what the membership looks like. But in addition, I think we have clearly demonstrated that domestic membership alone cannot transform global cardiovascular care. We can only transform cardiovascular care around the globe if it is done in partnership with our international members. And I would say that if I look 3 to 5 years from now, I hope that our efforts look representative of our membership, and I hope that we are working hand in hand together to make meaningful progress in reducing cardiovascular morbidity and mortality.
Pam, you really put your hand on a very important point, and absolutely you're so accurate with that. I look at the international members are our ambassadors in achieving that target, to be honest, and international governors as also our true executives of this initiative. So you've just said it. I think this is, if we look globally of how can we impact the cardiovascular disease burden, it is by actually activating all the international cardiology community.
Mm-hmm. You know, Hani, one thing you didn't mention, which I think is really exciting, and you've been involved in this, is, and I have not yet been, other than one meeting, is the Ministries of Health. Can you mention some of your efforts with the Ministry of Health?
Yes, absolutely, and this is part of the initiatives that we're looking to grow internationally. Is connecting with ministries of health. Now, it is good to connect with individual cardiac centers, elevate the quality, elevate and smooth the care delivery and so on. But it's even of a bigger impact if we're able to connect with the ministries of health around the world. And we have actually had connections with the Mexico Ministry of Health, with Saudi Arabian Ministry of Health. And I think this is an incredible initiative that can impact an entire country, not only the patients that are served by that heart center. And I think if we are able to add and expand onto these Ministry of Health initiatives, I think we are able to impact globally in different countries around the world. Absolutely right. Thanks for reminding me, Pam, about this.
And I'll just add on there that with the 5 meetings that we've shared with the Ministries of Health around the globe this past year, we've had, really fruitful exchanges, including it's always important to have the Minister of Health or his department support these global quality initiatives like the Global Quality Solutions or the GADI, or in the case of Mexico, and Pam, you were involved in this. We actually partnered them with the Arizona chapter in Quan Lee and have gotten a recent project there in Arizona that they're administering to immigrants, legal immigrants that don't have proper health resources there in the Southwest, and providing programs for them. So, there are a lot of different ways that these exchanges, including just being, models not only within those countries, but also for neighboring countries. So, this has been very, very powerful. I'm going to turn it right now to another global leader that's here in our audience. Cesar, you're always not stuck for words. I'm hoping Dr. Cesar Herrera, who's actually been one of our major leaders with the GADI project and is also one of the co-chairs with Juan Aranda of the ACC Latin America Conference, I think September 1921 in your home country, Punta Cana, Dominican Republic. Cesar, you want to comment on any of the others of these comments? And then we'll be monitoring the chat, and also if you want to put your hand up, we'll try and see if we are able to have time to call on anyone who has questions or comments during this period. Cesar, you have the floor.
Thank you, Hadley, and thanks for the advertisement for the conference. We hope to see many of you in sunny Dominican Republic in September. And thanks to Pam and Hani and all of you. I think you know that this has been a passion of mine. I'm sort of a mix of 32 years of Chicago and now 8 years in the Caribbean. And to me, it's been an honor and a ride to be able to both feel the reputation that the college has internationally and also be able to provide my small portion of work through the college in so many needs. You know, the interesting thing that I have experienced in the last 7, 8 years is that across the world, our problems are quite similar when it comes to cardiology, cardiac care, and patient care. The solutions are difficult and different, and I think Pam already alluded to that. They have to be customized. And so I in my experience, I mean, sharing Gati with you and many other leaders and impacting STEMI Care, the Global Graduate Educators Work Group that Andy Cates and I are pushing forward to begin creating this pool of educators and young trainees as the future faculty locally to improve training and education, partnering with chapters, your institution, partnering with the Chilean chapter. Now we're partnering with the Massachusetts chapter, with Colleen Harrington as a governor, and we're actually presenting a project on cardiobstetrics. And I can go on and on. I mean, the in-training exam, there's so many opportunities that the task force has ahead that they may seem to be monumental, but they're really not. And Hani, you hit it right in there. You need the partners, the local partners. They have to guide these with the college support and the guidance and experience, but it's their game, it's in their court. So kudos to the college for doing all this, and thanks for the opportunity.
Absolutely. Thank you, Cesar, for all the great work you're doing as well. And so now for our panel here, and it looks like we've adopted Cesar. He can come and go as he will on the gallery shot. But what advice would you have for our members who are really interested in trying to do some more personal exchange, which I think all of us on the screen have found extremely fulfilling, with international work and doing international exchange? It's almost an antidote to clinician burnout. What advice would any of you give to ACC members that want to try and become involved in the international program, perhaps even in their chapter or their section? How would someone start that really hasn't been involved in this before? Pam, you're usually good at mentoring people and pointing them in the right direction.
Well, I think this is really important. And I'm going to actually give some advice that is actually identical for domestic and international members. There really is no difference in this. And that is that every member who wants to become increasingly engaged needs to start somewhere. And my advice would be really 3 things that are critically important to start your engagement with ACC. Well, I'm going to begin with 4 things. Number 1 is join. Number 1 is you have to join the college. You have to be a member of the college. But number 2 is a great place to start is your domestic or your international chapter. And then I encourage those chapters when you are engaged with your local regional ACC chapter, or whether that be a state if you're a domestic member, become engaged in some of the work groups or the task forces of your chapter. This begins to build your profile and your qualifications to grow within the college. From there, once you've built, and in addition, another great place is join a section. So every section has work groups. I was chair of the prevention section. We had 9 or 10 hypertension, dyslipidemia, healthcare disparities, diabetes, and cardiometabolic disease. Joining a work group does not require nomination process. It just requires participation in the calls. They oftentimes write papers, prepare slide sets, put on webinars, etc. Again, joining a section and joining a work group is a great way to begin to build your profile. Once you've done that, you begin to have a nomination letter, a nomination profile that makes you look very attractive for now leadership within perhaps a member of one of the ACC committees that are international in nature, or membership on a section leadership council. So I think that advice that I've given applies to all members, no matter from what country you come. Hani and Caesar, I'd love to hear what you think about that. Other ways to become engaged.
I think you said it well, Pam. I think just if you look at us 15, 20 years ago, where we were and where we are now in terms of how we grow with the college. And I think it's just incredible how when you first become part of the family of the ACC, as you said, number one, join the college. But then after that, just spend the time and the efforts to be part of the family, and all of a sudden you become recognized for who you are, what you do, and you continue to grow. And then it's a two-way knowledge, as we always say. And you grow, you become recognized for what you do, and you learn so much from the college. And I tell you, through my journey with the college, I have personally learned from so many luminaries around me, not even only in medicine and cardiology, but I've learned how to conduct meetings, how to talk, so a lot of learning that comes with the college that offers, because you are with an incredible leaders in their field. And certainly you start learning from all the other non-medical stuff, as we call it, that makes you better physician at your own practice or in your own hospital. So a lot of really return back on investment when you put it out there with the college.
Thanks, Hani. Yeah, and you're referring to those non-clinical competencies that we understand now are so integral, so important to being, the complete physician, the complete provider, the complete leader. And let me just also comment again that Autumn Strauss and the team have been putting in some great information about how to join, in your chapter, how to join a section, how to join in the international program. There's some great information that's still there in the chat, with resources for you to check on as well. So let me just sort of maybe step back a little bit. As we do on some of these heart-to-hearts, we like to call on some of the luminaries that are in our audience as well. And that is that, we have now, as I said before, over 16,000 members who are so-called international or live or reside outside the U.S., nearly 1/3 of the college, and we are a global organization. But that was not the case 20 years ago. And, I'm going to see if you're available, Thad Waits has seen it all. He's seen it develop from, I think, as early as 2005, when we first started thinking about expanding internationally, or at least making it a concerted effort. So Thad, thank you for joining in on the fly. Glad to see you, and happy to hear any comments you want to make about the history, really rapid history here over the last 20 years of adding 16 members and truly being a global organization.
Henry,
good to see you.
Thank you. Good to see all of you. You're so right. As I sat here listening to all this, I was thinking about the history of it. And one of my real fond memories is walking into a meeting room. I wasn't even sure exactly what it was, but Hugh Gray was there. And I'm reasonably positive that Antonio Chagas was in the room at the same time too, and talking about how to pull all the governors together, or the International Assembly together. And at that time, I was on the Board of Governors, incoming chair of it, and Ewan started asking, how can we do this and how can we make it similar to the Board of Governors that's already existing? And so we were more or less the template for that as it got started. And it's just been a remarkable advance since that time. Very impressed, and great comments from all of you. Thank you so much.
Well, it's great to see you, and thank you for giving us a little bit of the walk down memory lane and how this has rapidly advanced. Just in more recent history, the first sort of international acceleration we put together in 2019, and now this is the second round. We did, have a little bit of a stalemate there, like everyone did during the pandemic, but things are again moving and starting to progress rapidly. And I think, we've got a lot of momentum starting to build here. One of the things I think that makes ACC unique from other international organizations are that the members actually individually join. And unlike, say, ESC or some other organizations where if you're a member of a local society and that society is a member of an international organization, then everyone that's in the local society is a member de facto. So our members are committed, the ones that are part of ACC, and we hope to give them value and get them engaged as we move along. So Dr. Chagas has been putting in some good comments about the 142 countries or so where we have members, and the now 42 chapters, and how that has been a great platform for us to grow these programs like the Global Quality Solutions, the GADI, and so forth. So either of you want to make any comments about specific things that the task force is working on currently, and your report as you see that coming out for the next few quarters this year?
Well, I think, one thing I would like to do is actually take your question and turn it back to Caesar. And I'd like to ask him about what is being done. He mentioned in the comments, one of the most important priorities is member engagement. And I think that's what ACC is. ACC is transforming care and member engagement. And Caesar, I know you've been working with the AIG to help some of our members apply, become engaged. And you pointed out the importance of the FITs in the early career. I'd love to hear what you're doing in the AIG to support the members directly, those of you who are in the regions.
Yes, I during my 4 years in the AIG Steering Committee, particularly in the Americas, we identified a need, as I stated in the chat, to engage early career members and FITs, not necessarily focus on them only, obviously, we welcome every generation, but looking at them as a way to even pull their own professors over, because they are very fluent in the language, they're very familiar with technology, they're very eager to engage. And there has truly not been a tradition in many countries of having FITs, and it was a surprise to many people that I contacted, particularly in South America. In fact, I remember vividly in Colombia and Argentina and some other countries, and even in Mexico, Javier Escudero did a great job. We made a ton of FITs members of the college because they weren't aware that they could be members of this great organization for free. And so along with that, the engagement of the governors is key, Pam. And we were very successful in getting a lot of people active, not only in growing membership, but also picking up things like NCD Academy and even GADI. And so the local governors are an important part of this. Now this is happening, and Alyssa McCormick has done a tremendous job in quote unquote, educating governors, incoming governors, about what their role is, what they can do, because many people, frankly, are not terribly aware of the ins and outs of the college. So you said it, Pam, starting with membership, going through applying, don't have to be afraid. I think that all of that has created a cadre, and I think I can mention 8 or 10 people that are now current members of sections, and including, important committees of the college. So I think the future is very bright in that regard.
Cesar, one of my things that is so great, whenever I go to the international meetings, as you said, the FITs and the early careers are just so hungry. My favorite thing after interacting with them for the 3 days during the meeting is many of them who presented research or are able to come to the ACC annual meeting. And it's so much fun as we're walking around the annual meeting, the number of taps on the shoulder I get from one of the fellows in training or one of the early career folks who will tap me on the shoulder and say, Dr. Morris, do you remember me? It's just great fun. And I think that personalization, the more that our international members come to know our leaders and our leaders become their friends and their colleagues, the better we can engage them and keep them within the college as growing leaders.
Let me just add that Dr. Chagas has been dutifully trying to help us as much as possible and has typed in the chat important information. The Global Leadership Institute now from ACC's international program. The Global Leadership Institute now has 430 participants, and the Bill Zogby Awards, 68 applicants this year. Gotti, Cesar, I didn't even realize this, Gotti's up to 11,336 STEMI cases over the past 5 years.
And counting, yes.
Across 20 countries.
That's correct. 21 countries, and we just onboarded 7 sites last week.
Oh, that's amazing. That's wonderful. And then the Value-Based Healthcare Initiative has over 23,000 users across 147 countries. So, it's multidimensional. It's not just, quality programs, which obviously are the heart of ACC, but also, value-based care and other initiatives and collaboration. So it's just, it goes on and on. It's really terrific. So, Hani, do you have any special comments at this time? You have been very humble talking about the Hani Najm Scholars Program, but I think it'd be wonderful just to describe a little bit about how these young minds can come over and just, I would think, I would like to do it, would be bedazzled by coming to your institution or similar institutions for an observership and just see where, medicine is going and where, the possibilities are endless for them as well.
Absolutely, Hadley. So this is actually an opportunity. You cannot believe how honored and privileged that it actually, I do carry this award. To be honest, it's just an incredible honor. When I see younger cardiologists coming in, early career coming in, and they would spend a month at a leading institute and at the Cleveland Clinic or any other institute in the United States, and then attend the annual meeting, you won't believe how much gratifying to me, let alone how much they appreciate that. I mean, some of the early career cardiologists have not even left their country ever. And now this is their first visit to the United States. It's just an honor to give that opportunity to some of the early career cardiologists. And Pam, to your point, when you get some taps on the shoulders, imagine that I actually get emails from them. I get, how are they doing in their career? And I see them also in the next annual meeting, and they become part of the ACC family. It's just an incredible experience, I have to say. So it's so rewarding. It's so good. I think I'm hoping that we can have more and more of those young early career cardiologists who can come and really learn from these major institutions around the United States, as well as the annual meeting, the scientific meetings of the ACC.
That's terrific. And I think Antonio put in that now there are 54 recipients so far of the Hani Najm Award. That's really terrific. Okay, well, we have about 10 minutes left, and this is probably where we go around and just say whatever pithy thoughts you have for the group regarding international and where you see this going, and just your thoughts about what you think it'll be like a year from now or 5 years from now for ACC. I'll probably include Caesar on this as well. So Pam, I'll start with you.
Well, I guess what I really want to see is, I've said this before, I would really like to see our programs, our activities, our efforts. I would like the college to be representative of our global partners. Again, as I've said, we cannot do this alone. We cannot transform care alone. And this is a team effort. And I'd really like to see our international membership grow and our international efforts to transform care grow. And I think the new strategic plan that will be debuted at ACC 24 truly demonstrates our commitment to growing that engagement and those efforts.
And Hani.
Yeah, so it's again, I just want to echo Pam's comments. I think how can we make ACC as the global home for all the cardiologists around the world? I want to recognize also Antonio Chagas' leadership that he has been actually doing. Unfortunately, we can't hear from him due to technical difficulties, but he has actually done an incredible job as the AIG chair. Similarly, the KK before him. And I think with leaders like Antonio Chagas, we should be able to really deliver the mission of the college being the home for the international community of cardiologists.
So I will add my own comments, which, and I think all of us have experienced this, that wherever we go around the world, the ACC is really held in the highest regard in terms of the true trusted source of knowledge. And also, we have an incredible number of FACCs outside of the U.S. because it is viewed as one of the highest bars for cardiovascular attainment. And so they really are always pleased, not just the president, any of the members of the ACC that are at these meetings. They are just really happy to see us, happy to hear what we have to say, happy to engage and collaborate with us. And I think that, this is really a special relationship. It's, as I've said a few times, hopefully I haven't worn it out, but I think it's true that we're all cardiologists and cardiovascular team members and cardiac surgeons without borders. And I think this is really a special relationship. I mean, obviously, it's an unsteady time in certain parts of the world, and it's worrisome and anxious. But if we can be solid in our support on the medical and the cardiovascular front, I think that's so important in building the trust, for the cardiovascular clinicians, and then hopefully, for the society, so that we can make this a better world. So to me, that is one of the most gratifying things, is to see that, despite all these other societies and internet, and we're not really in competition. We're all together trying to lock arms and collaborate to, try and work together against the growing burden of cardiovascular disease. So I just think it's really great that ACC is really in the spotlight as a trusted source, not only just in what we say, but in the scientific information and research and so forth that we present and that we bring around the world, as well as we receive. And now, we're starting to have CASAP and some of our material, well, actually many different areas of our materials translated into other languages, including now there's a JAC Asia, and potentially, there will be other JAC publications that will be, translated into perhaps Spanish and Portuguese and so forth down the line. So we truly are trying to be that global organization, but also grounded on the fact that our members, our ACC members here in the U.S. are really the anchor for all of this. And that's truly what we want, is we want to improve, diminish cardiovascular disease in the U.S., but we also want to do that worldwide. So Cesar, I know you have a very unique perspective, as you said, Dominican Republic, Chicago, and now you've really got a leg or foot in two canoes now in the Dominican Republic, and also such a strong ACC leader. So what are your thoughts about how ACC is viewed outside the domestic U.S. and where you see us going?
Well, as I said before, I think the reputation this institution has is cannot be described, and that comes with responsibility from our part too, right? And I just want to mention one thing, because time is running out, that has not been mentioned in terms of looking forward. Research. I don't want to claim that this is a byproduct of GATI, but for the last year and a half, the international meetings have begun to include research seminars locally. We were so thrilled and happy to be part of the first one, run by Chandra, Dr. Chandra, the editor of JACC Imaging, last year in Costa Rica. And this year we're going to have Candice Riverside. And what we're trying to do is have these 2-hour-long seminars, if you want to call it, where people interested in research, clinical research, registries, you name it, can come and exchange their ideas with folks that have done it, tips in how to publish a good paper, tips about how to come up with a good grant, because that's really needed out here. I mean, cardiovascular disease is the same all over the world, but the specifics, particularly social determinants of health, make a big difference. And so that's an important thing to look into the future.
Cesar, that was one of the most well-attended sessions in Costa Rica. The early career people, even some mid-career people who wanted to get their research to a broader stage, that was so well received.
It was 9:45 p.m. and we still had over 50 people in the audience.
Mm-hmm.
All right. Well, our time is drawing nigh, and I do want to thank you all for being here with us this evening. I think this has been a very great informational exchange on our international program, past, present, and future. I also want to thank our guests, all of those who have tuned in, and I particularly want to thank our other hosts here along with me, Dr. Hani Najm and Dr. Pam Morris, and also Dr. Chagas, who is there on the screen and in spirit, and has been really providing some great information along with our wonderful ACC staff. So our work together is so important to our efforts to transform cardiovascular care and improve heart health for all. And so we do hope that everyone's going to be able to make it to Atlanta on Saturday, April 6th, for another and my final heart-to-heart discussion, which will be focused on the college's 75-year legacy as the professional home for all of cardiology, and a look ahead at how we can continue to shape the future. And again, there's just been some incredible resources in the chat provided by Autumn Strauss and others on the staff, but you can find more information at acc.org, ACC President. As a reminder, this session is also recorded and available to share in the coming days. I probably believe on ACC Anywhere. And now my favorite part of the program is when we get to share our toast or heart-to-heart toast as we do at the end of each of these meetings. And so I will bring forth my particular concoction for the evening, which I'm just now pouring, which is, there we go, a tequila sunset with a heart-to-heart logo on there. So that's a mocktail tequila sunrise. Caesar's smiling. I know he's going to have something much better. And
Were you in Mexico by any chance?
yes, I was, yes. Yes, I may have this. I'll say this is where I learned it. How's that? I know, Pam, you have one as well. Oh, and Hani's got his as well. That's good. And oh, Dr. Chagas. All right, so let's all together. Pam, are you on the screen?
Actually, I may have frozen.
Oh, okay. Well,
Sorry. I've got mine right here for you. Sorry. I think my internet has frozen.
I see. Well, you know, maybe we can hear your ice clink in the glass, but
There you
I'll verify for you that earlier I did see your drink. So to all of us, heart to heart, to good health, and cheers. Thank you all for joining.